of getting people into a position where they are ready to receive that help, where, like him, they want to receive that help. Now, interestingly enough, today is also the day known as Welfare Wednesday. Will we see another spike in overdoses today? To address this matter further, joining us is Nirmala Raniga. She's the founder of Chopra Addiction and Wellness Center. Hi, Nirmala. How are you doing?
I'm good, Nikki. How are you?
I'm good, Nirmala. Thank you. Yesterday, when you heard those figures, 175 people had died in this province from drug overdoses. How did that make you feel?
Well, I had to take some deep breaths, right? Because we have been seeing the numbers for the last, since May, June, July, the numbers just, over 70 people. That's a lot of people dying in a month. When we look at this, it's like 5 people we're losing to overdose. That's not acceptable. It's just not acceptable. We can do more, and we should be able to do more.
Mm-hmm. When it comes to doing more, what do you think it is that the province needs to be doing in order to get these numbers down?
Well, the biggest thing has been is with COVID-19, the isolation has forced people to go into spaces, and when you already addiction is about isolation. I think I've talked about this before, but we need connection. And how do we create that connection so that people can get help? I spoke to all my clinics this morning just to get a feel for where things are with people. There's more people who want to come out and talk to a counselor. They want resources. They want support. But a lot of places are still not fully open. And while I know the government is doing what they can, but this has been sort of a systematic problem right from the beginning, the addiction part of things. Because, when you look at COVID-19 and how it came up, how it's been managed, opioid crisis has never been managed that way. It hasn't been managed that way. There's things that come out in pockets, but never, like if you look at it, there's gaps in, and there's always has been gap in mental health and addiction. Mm-hmm. It was never really recognized that these are really serious problems human beings face, is when they get into addiction, and addiction needs help, support, and not just on one level, on multiple levels. And how do we connect all those dots so that people don't fall, between the cracks? How do we get them from point A to B? And with when you look at current issue, if there's focused on just a very specific area, do we really know if everybody has cell phone? Do we really know people can make a call? Do we know people have computers to access resources? We are just assuming some of these things. So I think there has to be a little bit more education awareness, but more a sort of a system in place that when somebody wants a service, there should not be a gap. And how do we do that? Do we create more outreach groups that go out and knock on people's doors? I don't know if that's the answer. But it's not just one thing, Nikki, when we think about it, there's a multiple level of issue here. We have, when we think about just the isolation, the lack of resources, when you look at the organizations, the VCH, Fraser Health, I mean, they are doing what they can, but at the end of the day, are those services easily accessible to people? I think that's where the issue is, the access. But beyond that is something we call shame that people really don't talk about. Mm-hmm. The shame, which is the hidden emotion of human beings. And we all know what shame can feel like, right? When for example, I was talking to one of our counselors this morning, and she mentioned that more and more people are now coming to the office and really talking about how they felt because they had relapsed. And shame is the thing that will prevent people to seek help. So even if somebody, for example, has been doing okay, not drinking, not doing drugs, and with this COVID-19 pandemic, which has forced people to be a certain way, because as you know, human beings' nature is to be social, to be connected. But now we are forced to behave a certain way. We can't give people a hug. We need to maintain distance. All this has really separated us. And so when people go into isolation, they have time. What do they do with the time? So the old stories of the past comes back, and how do you cope with that? Mm-hmm. It reinforces the choice of going back and using, because that's what helped me in the past.
There was a caller earlier today on this radio station who I heard, and this is a fellow who had called in and said that he himself was a drug addict, and he struggled for years with his addiction problems. But he said he had to be ready to change. He knew that there were services available, but he had to be ready to change before he was able to change. How do you get a person ready to change?
I think we need to, Nikki, start talking to people right up front. It's about creating that awareness. When we're giving out all these harm reduction services to those who are accessing harm reduction services, is having conversation with them that, there's something beyond this harm reduction. There's recovery. There's resources that you can get a life that is of worth, because most people don't feel that they are good enough to get there.
Nirmala, thank you so much for sharing your expertise with us today on this.
Yes, and the other thing, Nikki, just one more last point. Next week is Recovery Capital Conference, which is a big event. It's a virtual event.
Right.
And, we'll have lots of resources there. I will be there on Zoom, and people can ask questions.
Great. Thank you so much, Nirmala.
Take care, Nikki. Bye-bye.